Good afternoon and welcome to the 5,281st meeting of the Rotary Club of Tulsa, Club 2500, District 6110. Jerry, I appreciate you wearing that hat to keep my head warm today. It's chilly out there. It's always a good time to be together as Rotarians. We've got another great program for you today, but before we start, we're going to have invocation and pledge led by Ashley Cutshaw, followed by guest introductions by David Bryant.
Let us pray. Heavenly Father, as we gather today, we thank you for the gift of community and the chance to serve others. In this season that often pulls our attention towards busyness and buying, help us refocus our hearts on compassion, generosity, and the needs of those around us. Guide us to be mindful, grateful, and giving in all we do, and may our actions reflect the true spirit of service above self. Amen. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation,
under God, indivisible, with liberty and justice for all.
Good afternoon and welcome to the Rotary Club of Tulsa. If I may say so, this is the best looking crowd we've had this month. Timing. When I announce your name, please stand with your guests so that you all can be recognized. Ever proving that Rotarians constantly outkick their coverage, Joe Moran has brought his lovely wife, Darcy. And visiting Rotarian Joel Cousins, and his son is the host Rotarian, Grant Cousins, so I guess we'll say hi, Joel, and hi, Grant. They pick me on these days where there are so few guests, they get me off the stage quicker, so thank you all.
Thank you, David and Ashley. Got a little bit of sad business to start out. You all probably saw the announcement that Pedro Figueroa passed away on November the 30th. He was an extraordinary individual, an important member of our organization. His kindness, service, and generous spirit touched all of us. His legacy will continue to shine through the countless lives he influenced through his career, through Rotary and his other commitments. He truly embodied the ideal of service above self. Our thoughts and prayers are with the Figueroa family during this difficult time. You may know that the funeral is going to be tomorrow, I believe, at the Church of the Resurrection. It's scheduled, it's the 11th. It's been, okay, that's great, because our bell ringing is tomorrow, and I was going to say that Pedro would want us to carry on with our commitments, but we don't have a conflict there. So I hope you'll be able to attend his service at the Church of the Resurrection. And our member Joe Moore is handling that for the family. We have some good news. The good news is that the Rotary Plaza on Williams Center Green is undergoing an awaited makeover, and they've made tremendous progress on it. All of the statues have been cleaned and polished and resealed, and they've trimmed back the trees. I saw Tim Nall earlier. He helped us with that. In prior years, Tim has kind of been a solo act on helping us with that plaza. This year, he had the help of Jerry Stamper, Curtis Craig, new member Phil Ashley, as well as Tim himself working on that. And we want to give a special thanks to our Rotarians who made that effort. We've got a little bit more work to do with the electrical to get some more lights brought back up, but we're thinking that plaza is going to be in great shape for the centennial celebration of Route 66. A lot of visitors will be coming to Tulsa. We want to be well represented by that facility. A little little bit of Rotary DNA on that. The Rotary Plaza was a $1 million gift of public art presented to the citizens of Tulsa as our club's official centennial project. It took us 7 years of planning and preparation and fundraising to pull that off. It is, in fact, the largest single endeavor in terms of a contribution made in the history of our club, and it was made entirely by the generosity of our members and their commitment to this project. I know quite a number of you were here at that time and participated in that. The legacy you generated there will stand long after the time has passed for the Route 66 centennial. We want to thank the Rotary Club of Tulsa Board of Directors and our foundation trustees for their leadership and support in having the funds available to produce the service to those statues and that plaza. Here's a little more holiday Rotary DNA for you. In 2002, our current district governor, then member John Raines, launched one of our club's most cherished traditions, an annual outreach to at-risk Tulsa children who might otherwise only know law enforcement officers in difficult circumstances. Each year during the holiday season, our Rotarians join members of the Fraternal Order of Police, yep, those are the guys with the guns, at a local Walmart to meet students from our Partners in Education School, Celia Clinton Elementary. The officers who are present help each child shop for gifts for their families, while Rotarians select special gifts for those children. What began as a simple gesture has become a beloved tradition, one that has brightened countless lives and brought joy to families in need for 23 years. We're going to be doing that again this Saturday. If you've not previously participated, you should seriously consider it. Today, I'm going to talk about an especially meaningful Shop with a Cop year, December of 2020. Paul Ballman remembers it well, because I think that's when you were president and I was sergeant at arms, and it was the height of COVID-19. There were many questions about whether Shop with a Cop could even be held that year and be done safely. But we knew that it was a year when those families needed us most, so we found a way. The registration for the event was moved outdoors. Rotarians, officers, volunteers, reporters, teachers, and students shopped in masks. Aren't you glad we don't have to wear masks anymore, Linda? My goodness. You couldn't see the smiles that were blocked by those masks, but you could feel them, and you could see the hope and compassion coming through in those children's eyes. In that moment, the true spirit above self was, the spirit of service above self was unmistakable. It remains one of our club's proudest memories. Please turn your attention to the screens as we look back to December 2020. Some of you may not be aware that Mattress Firm and Mark Allen Chevrolet support our efforts in the Shop with a Cop program by making substantial contributions to the purchase of those gifts. They're not members of Rotary. If you know anybody at those organizations, please hound them to join us. But they contribute to our cause because of the value we add to the community. Rotarians, your gifts of time and treasure means more than you know to the families we serve. Thank you for making the holidays a little brighter year after year. This year, Shop with a Cop is on Saturday, December the 6th, from 8:45 to 11:45 a.m. at Walmart at 207 South Memorial. Monica, are you signed up to do Shop with a Cop with us this year? Yeah. How many of you have signed up to do Shop with a Cop? Thank you to all of you for doing that. It's much appreciated. Now, we have a couple of side mic announcements. The first one is from DJ Morrow Ingram.
Come on, say something. There we go. Now he won't shut up. Okay, there we go. 'Twas the week before Christmas, and all through the club, not a Rotarian is going to be restless. Everyone's ready for festive fun. The boots will be polished in Stetsons with flair in hopes that a Western good time soon will be there. Rotarians are gathering, each one with a grin, as news of a Christmas shindig comes riding on in. Y'all better giddy up, partner, and don't you be late. We're Christmas hoedown bound on the 18th. Save the date. It's at Sarah Stokely's home. We two-step and cheer with lassoed-in laughter to round out the year. There's great food and fixins from Tiamo's and more, tall tales and toast and surprises in store. And best of all, music by Janet Rutland and Scott McQuaid, bringing Western holiday magic to every serenade. So dust off your denim, your fringe and your plaid, your boots and big buckles, the more Western the rad. We jingle our spurs, we carol and sing and celebrate friendship that Rotary brings. So hitch up your sleigh, or your pickup is fine, and ride on to Sarah's for a root tootin' time. Registration is in the Monday morning memo. So saddle up, partners. This is one holiday roundup you don't want to miss. Yeah!
Come on up, Brian. You're the man.
I gotta swim up here, all right? Someone's been feeding this goldfish too much food. Hey, everybody. All right. Thank you. If you're gonna say thank you, you do it in Rotary style. You get dressed up, right? So thank you, fellow Rotarians. You came through once again for our Celia Clinton Littles, all right? I'm talking kindergartners that need goldfish, the other kind, all right? Those little crunchy, delicious goldfish. Who's had goldfish before? Oh, they're delicious. And who's had candy canes? Oh, yeah. And we're going to be delivering those today, right after the Rotary meeting, all right? I'm going to go up and I'm going to make a special appearance as the candy cane goldfish, and it's going to be great. So we're going to have a good time, but I just wanted to say briefly, thank you. Thank you so much. You're thinking of the littles at Celia Clinton. Y'all have a Merry Christmas.
Jenny, have you ever heard of a candy cane goldfish before? No, that's confusing is what that is. I get to introduce another fantastic Rotarian of the day. Kim Hill Kroll has long recognized that mental health and substance abuse, one way or the other, touch every family. To have a meaningful impact, she began her career as a child care worker in a youth shelter and has since dedicated more than 25 years to the mental health field in a variety of roles. For the past 17 years, Kim has been a key leader at Grand Mental Health, where she currently serves as Chief Clinical Officer in Tulsa. She oversees clinical operations and healthcare delivery across Tulsa County with a focus on strong outcomes, client safety, and fidelity to Grand's treatment models. Kim holds an MBA and is a licensed clinical social worker, which makes you a perfect member for this club. Blending clinical expertise with strategic leadership, she has contributed to the advancement of mental health care through published works and conference presentations, including co-authoring Working Therapeutically with Families, Creative Activities for Diverse Family Structures. Please join me in welcoming our Rotarian of the Day, Kim Hill Kroll.
Thank you so much. I'm very excited to be welcoming Carly Zanger Wigneraja because our work together is so phenomenal and touches a lot of Tulsans. Our outreach team at Grand works directly with Tulsa Cares, and so I'm very excited. Carly serves as the CEO of Tulsa Cares, bringing more than 20 years of nonprofit leadership to that role. Prior to becoming the CEO, she spent over 4 years as the organization's Chief Development and Communications Officer, during which time Tulsa Cares saw significant growth in grant funding, donor engagement, and strategic initiatives, along with the continued success of the Red Ribbon Gala. A native Tulsan, Carly holds a degree in Business Administration from the University of San Diego and a Master's in Public Administration from the University of Oklahoma. Early in her career, she gained valuable experience in New York City and Washington, D.C. before returning home to Tulsa. She is a graduate of Leadership Tulsa and has served on the board of City Lights Foundation of Oklahoma. Please join me in welcoming Carly.
Thank you so much, Kim. Thank you, Chaz, for the invitation to speak today, and appreciate your willingness to have me here. I'm very excited to share more about Tulsa Cares, and I must admit, as I was preparing for this presentation, I reviewed your speaker lineup as of late, and you've had some heavy hitters join you, and I'm sitting here thinking I am not nearly as accomplished or probably as interesting as half these people, but I will certainly do my best to get over this imposter syndrome and hopefully share maybe a different perspective than you're used to hearing at these meetings. I forgot my, thank you, sorry. Thank you. Before we dive in, I think it is important to acknowledge that HIV is a sensitive topic, and it is one that often carries history, emotion, and even uncertainty for many people. And that's completely understandable. So much of what we know and feel about HIV, we first learned during a really a tough time in crisis. And so what I hope to offer today is clarity, compassion, and a current perspective on what HIV looks like today, and specifically what it means for people living with it here in Tulsa. So who is Tulsa Cares? We are, at our basis, a nonprofit organization. We are a community-based social service and medical provider serving low-income people living with or at risk for HIV and hepatitis C. We focus on quality of life just as much as we do health outcomes, and that is a departure from where we started. We were founded in 1991 during some of the darkest days of the epidemic. We were organized as a community response of many churches and local leaders that felt like we needed more kind of impact in this space. And so Tulsa Cares was formed in the early 90s at a time when the community and families and people were really at a loss of what to do, what to think about HIV. And so our role at that time was really helping provide dignity in death for many people. For more than 30 years, we've worked to build trust, reduce stigma, and make sure that people most impacted by HIV deserve the care that they so deserve. Today, we serve as the state's largest provider of care and social service programs for people living with HIV and hepatitis C. And our belief is very simple. We believe that everyone deserves dignified, compassionate, and equitable care, no matter their income, their background, or their circumstance. So what do we do? At our very basis, we are here to address social determinants of health. Those are the things that directly impact our health outcomes. And once we're able to identify those issues, those barriers to care, we'll fill in the gaps, we'll take care of them, and then we'll get you linked to medical care. We'll make sure that you have access to health insurance. We'll make sure you can afford your medications, and if you can't, we'll take care of that for you. We're really there to make sure you are healthy, but in the long haul, we're also walking alongside you to ensure that you're meeting your goals and have a high quality of life. We do know when we talk about social determinants of health, we know that health is about much more than medicine alone. It is shaped by where you sleep at night, the food that's in your cupboards, how you access transportation, how you feel about yourself, who you have in your corner. What if you're couch surfing? What if most of your meals are eaten at Quick Trip? What if you take an unreliable bus system to your medical appointments? What if you're living with a lot of shame about your status? And what if you have very few reliable people to lean on? These are the social conditions that determine health outcomes, and these are often far more powerful than medicine alone. When I look at these social determinants, I know that my privilege predetermines in many ways how I access health care, how I talk to my doctor, how I optimize my health insurance benefits, how I maintain a healthy lifestyle. And we know that our clients, very few of them have that level of privilege. So it's incumbent upon an organization like Tulsa Cares to take care of them and walk alongside them. So who do we serve? We are serving adults living with or at risk for HIV and hepatitis C. We serve the 23 counties of northeastern Oklahoma. The vast majority of the people we're serving are here in the Tulsa metro area. We serve over 1,000 unique individuals every year, and that doesn't count the people we're serving out in the community. We do lots of testing and education events. We have weekly visits at Iron Gate and David L. Moss talking about this, helping reduce stigma. And even though we do serve people up to 500% FPL, which is about $78,000 a year for a single-family household, the average annual income of a Tulsa Cares client is $16,500. So I don't have to have you do that math to know that those dollars do not stretch. That's not enough to live on, and certainly not enough to take care of a chronic health condition. So the work, again, that we do is critically important to who we're serving. So we'll dig into our programs a little bit. When someone walks into the doors of Tulsa Cares, they don't have to navigate all of this alone. We sit with them, we answer questions, we help them figure things out and coordinate a lot of different things for them. Insurance, appointments, SNAP benefits, Social Security disability, referrals. We'll get you bus passes, we'll give you gas cards, we'll help you with your prescription assistance, whatever it takes to, again, remove those barriers of care and ensure that they can have success in their health. We always try and treat the whole person and not just the diagnosis. We recognize that the people who are walking through our doors often have many other pressing issues than their diagnosis alone. Our care is also very supported with those case managers and rooted in client goal achievement. It is a two-way street, and there's got to be skin in the game for you to be successful as a client at Tulsa Cares, but we also recognize that our solutions are not a one-size-fits-all approach. We walk alongside you to understand what you need and what it's going to take to get there. And as we think about mental health, we know that people living with HIV face much higher incidences of depression, anxiety, substance use, much higher rates of suicidality. So our therapists are here to provide free of charge individual, family, group counseling so that people can heal. We've got a lot of people dealing with a lot of shame, a lot of trauma, high ACE scores. There's a lot on their plate, and so mental health is a critically important service that we're providing here at Tulsa Cares. We also know that food insecurity is very common among people living with HIV. And good nutrition is critically important for all the obvious reasons. So at Tulsa Cares, we have a bi-monthly farmers market. We bring in high-quality wholesale produce, about 20 to 30 vegetables and fruits, bread, eggs, things like that, so people can shop twice a month to get those. We have an on-site grocery store where people can shop monthly. You shop alone. You shop in kind of a dignified environment. All of our canned goods are labeled consistently, and so again, that experience, it mimics in a lot of ways a grocery store. We have emergency groceries that you can access at any time. We have groceries specifically for people who are unhoused, so it's a lot of pop tops and things that are easy to open. We have a registered dietitian on staff who is working with clients on medical nutrition therapy. We can prescribe vitamins, supplements, things of that nature. Last year, we distributed over 120,000 pounds of food to our clients. Housing is another, it's our biggest program in terms of the money that kind of flows through Tulsa Cares and out into the community. Housing is healthcare. You can't focus on taking your meds and taking care of yourself if you're living in a hotel or couch surfing. We provide short and long-term rental assistance, utility bills. We'll pay for deposits. We help with eviction prevention, landlord communication, and really just housing education, helping people be good tenants. A lot of our clients don't have good role models of just how to live independently and how to live in a safe environment. We also use an alias LLC for our housing program. We cut lots of checks every single month, and so we want to protect the confidentiality of our clients and their status. And so if a landlord's getting a check from Tulsa Cares, it pretty much indicates that they're positive. And so we're doing a lot to protect our clients because discrimination is still very, very much a thing, especially in the housing environment. Last year alone, we paid $630,000 in rent and utility assistance, so some significant dollars taking care of a very vulnerable population. And all in, when you think about the full circle kind of comprehensive model of care, we provided 28,000 services in 2024 to our clients. So that averages about 26 services per client, which again just highlights the reliance that so many of our clients have on a variety of services offered at Tulsa Cares. So at this point, you may be thinking, this is incredible, I had no idea Tulsa Cares existed, or I'm so glad that this is in the community. And there may be some of you that are thinking, is HIV still a thing? Like, is that something we still need to worry about? And it's a fair question, and it's one I get often. And here's my answer. Bottom line, yes. We've made incredible progress in the HIV landscape. Modern treatment has turned HIV into a chronic condition rather than a death sentence. But the reality is that the disparities have actually grown and the epidemic is more concentrated in specific communities, and therein lies the problem. Stigma is still very much a real thing, especially in a state like Oklahoma. Stigma delays treatment, it delays people asking questions, it delays testing, it delays people coming through our doors. We also know that HIV intersects with poverty, trauma, access to health care, and it disproportionately impacts people who are poor and people of color. The disproportionate impacts are very much felt here in this community as well. In Tulsa County, 55% of the people living with HIV are people of color. And we know that that is not necessarily proportionate to our population here in Tulsa County. And just like there are food deserts, there are healthcare deserts. We know that people with the least resources often have the hardest time accessing quality, comprehensive care. About half of adults living with HIV are on disability, and the average HIV client has been with Tulsa Cares for over 7 years, which just, again, kind of illustrates that reliance on our programs and services. Looking at some local statistics, so there's about 1 million people living in the United States with HIV. We actually celebrated World AIDS Day on December 1st, this past Monday, and World AIDS Day is still an opportunity for us to reflect on lives lost and to also celebrate those who are thriving. I think it's important to remind everyone, though, that in the United States, we've lost over 700,000 people in the last 40 years to HIV and AIDS-related illnesses. We have about 8,000 people living with HIV in Oklahoma. It's not a huge number, but about a quarter of them live here in Tulsa. Oklahoma is also one of 7 states identified by the CDC for a very high rural HIV burden. And the rural complexities of taking care of people living with HIV is really, really challenging. We do have rural case managers. I just don't know that we're always going to be able to do enough for them in those rural populations. So it's really, really hard to reach them. And the stigma there is just incredibly high. As it relates to hepatitis C, Oklahoma has the 2nd highest prevalence of hep C in the country. Not a very good statistic to be proud of. That equates to about 53,000 people living with hepatitis C here in Oklahoma. So again, Tulsa Cares serves a very niche population, but there are many complexities to this work and it highlights the importance of why an organization like Tulsa Cares is so needed in our community. So for the majority of our existence, we operated fairly discreetly. We had a hard time in the beginning even finding people that would rent to us. And so we weren't loud and proud out in the community talking about the work that we do. In the last 10 or so years, we've really grown into our presence, building our voice in the community, especially around our commitments to testing and prevention and education. In 2025, we'll have presented at or participated in over 200 community events. So a lot of testing events, public health fairs, and a variety of things in the community where we're talking to people in very honest ways about getting tested. We know that approximately 40% of new HIV diagnoses are transmitted by people who do not know their status. So again, testing is so crucial for early detection. And for Hep C, many people don't know they have symptoms for years. Those symptoms, the virus can sit dormant for decades, and by the time you know that you are sick, you are extremely sick. Again, just testing so critical for early detection. And with hepatitis C, it's part of the reason we piloted the expansion of our HIV services into the hepatitis C space, recognizing the incredible need here in our state. And while the population is slightly different, with opioid use and justice involvement driving risk more so today, we know that we take really good care of the socially vulnerable. Now our hepatitis C program is a fully built-out program. It mimics in many ways our HIV services. Hep C is also curable in 8 to 12 weeks, and we've cured nearly 450 people since 2020. Another important concept that I'd like to share with you that you may not be familiar with is U equals U, or undetectable equals untransmittable. And what that means is that people who are living with HIV who take a daily medication can get their viral load so low that it is undetectable in a blood test. And if that viral load is undetectable in a blood test, it means it cannot be sexually transmitted to a partner. And that is an absolute game changer when we think about prevention and stigma around HIV. It allows people to live not only longer lives, but to have partners that are not getting transmitted the virus. And so until there is a cure for HIV, this is about as good as it's going to get. And I'm extremely proud that the clients living, or the clients being served at Tulsa Cares have a viral, or 91% of them are virally suppressed. So 91% of them are not passing along the virus as long as that load is undetectable. And the national average is about 65%, which again just speaks to the critical nature of the comprehensive care offered at Tulsa Cares. From an economic perspective, I think it's also important to talk about the healthcare burden of HIV. The lifetime cost of living with HIV is roughly $400,000 to about $1.1 million, depending on when you get diagnosed. And so our clients are not paying that bill. Somebody's footing that bill. And so I think, too, it's important to recognize the role that we play in helping reduce the economic burden of HIV here in the community. So our prevention and testing efforts are kind of the perfect segue and help set the foundation for our newest program and this new era of medical care. In 2022, Tulsa Cares brought on Dr. Maduri Ladd. She's an HIV specialist, and she was brought on to pilot medical care at Tulsa Cares. So our clients kept saying, I'm getting all these wonderful services from you. It's so comprehensive, but I'm missing the medical piece. And so we said, we'll try it out. We'll test it out. And it went extremely well, and so well that we decided to build our own clinic. We had a small capital campaign, and we broke ground last summer, and we opened our medical clinic that we've called Cares Health in October of this year. And so this is a 4,000 square foot clinic. It's conveniently located right next door to Tulsa Cares, and it not only elevates our medical offerings, but also just our commitment to providing health equity and in a safe, familiar setting for our clients. Cares Health also will be providing primary care for the community. So this is kind of our first foray into serving people beyond who are living with or at risk for HIV and hepatitis C. We have LGBT-friendly primary care. We'll do STI testing. We have an on-site pharmacy, so that will make it extremely convenient for our clients to be able to fill their scripts on site. We will continue to subsidize care for our clients living with HIV and Hep C, so those medical copays will continue to be covered, and we'll continue to support them with pharmacy assistance if needed. We'll also have a lab on site, so we have a LabCorp partner, and we'll have a phlebotomist on site drawing labs. So again, just making it as much of a one-stop shop for our clients as possible. And again, just a huge step forward in integrated stigma-free care for the community. So I'm sure many of you are thinking, well, how do you afford all of this? And it's a very fair question. We have about a $5 million budget. You can see the expense breakdown. Most of the money is going to our programs. But I think it's important to talk about the revenue sources as well. We have a fairly diversified revenue. About a little under half of our money is coming from the federal government. A lot of that is pass-through money through the Oklahoma State Department of Health and the city of Tulsa are two of our kind of biggest public funders. And so those are critically important dollars that we are very reliable, or they have been very reliable, and we continue to lean on them. We have a big event. I'm a little biased, but I think it's the best event in town. It's called Red Ribbon Gala. It's in our 29th year. This past year, we raised $1.35 million at this event. And so again, just a testament to the community who continues to get behind the work that we're doing. Incredibly compassionate, incredibly generous, and we're on track to have a record year for 2026. So that's very exciting, and about a quarter of our gross revenue. And then 12% is billing and pharmacy revenue. Those dollars are continuing to grow, especially with the new clinic. We hope to see that piece of the pie grow even more. We do bill Medicaid, Medicare, commercial insurance. We also will see anyone who's uninsured as well. And then we've got a pharmacy rebate program that we're a part of that provides some incredible unrestricted dollars that we're able to then kind of pay for medical copays and prescription copays that our clients may not be able to afford. We are a very proud Tulsa Area United Way partner agency. We were one of the very first agencies in the country that was an HIV organization, and again, just a testament to Tulsa and the compassion of this community. Tulsa Area United Way took us on in the mid-90s when what we were doing was probably not very popular, and so we're very, very grateful for the support that they've provided us for many, many years. And then the rest is really just grants and other donations. We have wonderful relationships with many of the family foundations here in town, and just extremely grateful for everything that Tulsa does. I think being a leader at a nonprofit in a city like Tulsa, it's just an absolute privilege to see how many people show up for us day in and day out, and it's very, very seen and very, very appreciated. And really in closing, I want to end with just kind of this idea that our clients and patients, they don't get healthier just simply because Tulsa Cares exists. They get healthier, they get better because they feel safe, seen, and supported. And when you restore dignity to someone's life, everything else improves. And so when we support vulnerable populations and when we address really complex public health issues head on, we strengthen the entire community, and every single one of us benefits. So I appreciate your time today. I'm happy to take any questions, and thank you again. Yes.
Yeah, one of the most amazing developments in medicine in the last 30 years has been that hepatitis C is curable.
Mm-hmm.
And so the medication's extraordinarily expensive, I know too. But do any of these people really have access to that curative therapy, or is it practical for these people, or how does that happen?
Absolutely. I mean, we are putting as many people on Hep C treatment as possible. We're working with a lot of the pharmaceutical programs for compassionate care and getting a lot of that subsidized. Also, Medicaid expansion has been tremendously valuable for our Hep C population, and so we are doing anything and everything we can to get them cured. And it's proven successful. But you're absolutely right. It is a game changer.
You mentioned World AIDS Day, which was Monday.
Yep.
And from what I understand, this is the first time since 1988 that the federal government hasn't recognized it in some way. What do you make of that, and is that something we should be concerned about?
You know, I hate to get too political, but obviously the work that we do has been targeted. I am happy to say that as of today, we have not lost any federal funding, and so that is promising. I try not to buy into that noise, at least related to World AIDS Day and the decision to not acknowledge it. There's been a number of things that have not been acknowledged in previous administrations, and so to me, it it doesn't undermine what we're doing. We'll just, I think if anything, it motivates us to continue to do the work we're doing, and it maybe underscores the importance of organizations like Tulsa Cares to still be present and taking care of people and remembering the 700,000 people we've lost along the way. Yes.
When I hear about your great healthcare facility that you opened up, I also think about the YMCA taking initiatives such as the KDY that has the pharmacy and help the local communities. Do you partner with other community agencies like that to get a greater lift across Tulsa?
That's a great question. The Y is not one that we are currently partnered with, but absolutely. I mean, it is like critically important that we're all in this together. We're on a number of boards and sit on different commissions, and we're referring out to people regularly. Many people know that if they come across a client or a patient that's positive, they can send them to Tulsa Cares and vice versa. As Kim mentioned, we refer out to Grand a lot because we're not doing behavioral health at Tulsa Cares, so we do have therapy, but we're not doing kind of the substance use treatment. And so there are great partnerships and a lot of synergy, and we couldn't do it alone. Yes.
You talked about awareness being such a big part of it. I think a lot of people can think that it's not them. Who should get tested and how often?
That's totally fair. HIV is something that, there are certain kind of clinical guidelines. I know pregnant women will get an HIV test and things like that. With Hep C, and obviously too, if you are at higher risk, then it's important to get tested regularly. There is HIV kind of prophylaxis treatment now too called PrEP, and so for people who are at higher risk, it's great for them to consider PrEP as an option. It's a daily pill, and now there's an injectable option where if you take that regularly, it will completely, I think it's 99%, eliminate your risk of contracting HIV. And so for a lot of those things, you're also required to have testing regularly. For Hep C, often the baby boomer generation, that's been a recommendation. As I mentioned, higher risk now is a lot of injection drug use. There's a lot of illegal tattooing. The incarceration rate is extremely high, up to maybe 15% of people who are incarcerated have Hep C, which is tremendously higher than the average. And so for people that have been exposed to, kind of a variety of those types of things, it's really important to get tested. And testing is super easy. We do rapid tests all the time, and if you get a positive, then you get a confirmatory test, which is a little bit more advanced. But what we try and do is just eliminate the fear. Ignorance is not always bliss. And so really just encouraging people to be brave enough to get tested, know their status, and then if it is a positive, we'll work with you. It's going to be okay, so.
I just want to commend you for what you're doing and the hope that you provide people who may feel hopeless in their circumstance. I have a dear friend who had HIV, and this is more of a spiritual question, but it's also one based upon how you measure hope. And Dr. Chan Hellman,
Yep. We do hope testing, yeah. Yeah, we do the survey.
So I'm asking whether or not that University of Oklahoma School of Social Work might engage in doing research with your clients, because you can measure hope. You can measure it clinically, sound, solid reasoning. So if Dr. Chan Hellman, I know he's a spiritually grounded gentleman that I know and trust a great deal for the issue of hope for all of us in each of our life circumstances. And I'm thankful that every employee of the state welfare department have been trained by Dr. Chen Hellman. So any comments about him?
No, absolutely. I appreciate that. And yes, we have partnered with Dr. Hellman and do use that survey regularly, in addition to a couple other surveys that our behavior or mental health team does. And so it's something that we're looking at and reporting on fairly regularly. So absolutely, we want to be a source of hope, and we want to be able to measure what hope looked like when you walked through our door and the resiliency of what it looks like down the road. So it's a great point, yeah. John, and then you. Okay, go ahead.
You said that a lot of your clients are experiencing economically disadvantaged situations. So how is healthcare costs and rising pharmaceutical costs having an impact on the people that you're trying to help?
The rising healthcare costs and pharmaceutical costs, they're not seeing that as much. Most of our clients, about half of our clients on Medicaid, about a quarter Medicare, about a quarter are commercially insured, and a handful, maybe, 5 to 10% is uninsured. And so they have coverage, and we make sure that most people have coverage. I think they're feeling the pinch in other ways, like housing, food, some of those variables that continue to skyrocket that they don't have as much control over. And we're providing supplemental support. We can't provide, all of it. And so we do work with them, and it's hard. They come to us and they're like, this is what I have in the month to spend, and the dollars just don't stretch. So I would answer that question maybe differently if Medicaid, significant changes to Medicaid happen, and if our clients do get kicked off Medicaid, it'll be a different conversation. So I'm hopeful that that's not the case, but I'm very, very grateful for Medicaid expansion in the state, and it's been a tremendous value to many of the people that we serve here.
You plugged the Red Ribbon Gala, your annual event, which I can attest is a very fun party. Would you provide the date and the other color on that?
Sure. It'll be February 28th, and more information can be found at redribbongala.org. We have about 750 people that come every year. It's a blast, and it's a balance of a lot of fun and obviously very mission-oriented. And so we've raised about $500,000 so far, and so again, well on our way to get to hopefully $1.4 million is our goal this year. And we'd welcome anyone that was interested in attending. It's a lot of fun. Thank you for that. I appreciate that. And that you bring up a good point quickly. An organization like Tulsa Cares is extremely rare in a community of our size. Oklahoma City doesn't have anything comparable to this. They do have services, and most communities have services, and whether it's local health departments or state health departments. But Tulsa Cares is very, very rare, and I feel incredibly grateful that we are able to provide those 2,000 plus people dignity and care, and walk again alongside them on their journey. When people have been with us for 7+ years, and some of them have been with us for 30 years, you know their family members, you know their struggles. There's incredible rapport building. I just left an all-staff meeting, and we talk about the people we lost every single month and have a moment of silence, and we talk through what we miss about them and what they meant to us. And so these are real people. These are not just kind of transactional handing out groceries, and not to say that those things are not critically important, because they are, and we need it all. But this just is a little bit different in terms of really being a friend to someone. So thank you for that.
Thank you again, Carla.
Thank you.
Carly, you mentioned feeling like an imposter. Let me assure you, you are no imposter. You and your work are the real deal. We're thankful for you. We have a book today honoring today's program. It'll be donated to our partners in education at Celia Clinton Elementary. The book is The Helping Sweater, and we'll ask you to inscribe that when you get a minute after the meeting for us, Carly. Upcoming programs, December 10th is Kate. Can you believe it's almost Christmas? Holy cow. December 10th is Kate Neary. December 17th is our holiday program. We've got the Tulsa Opera coming in for that. Scott Philstrup helped us with that. Chaz Craig put it together. And they tell me I've been voluntold to do a couple of Rotary DNA pieces related to Christmas. Tina has put together for us. They should be really good as usual. December 4th, bell ringing. And I understand that's at Reeser's at 15th and Lewis. No. 45th and Yale? No. Oh, there's 3 locations. Okay, good deal. Sorry about that. To the chair of the bell ringing committee, I'm sorry. December 6th is Shop with a Cop. December 18th is the holiday party that DJ introduced us to. DJ, could we get you to do an announcement every week in that get-up and write a little poem for us? That was fantastic. I don't see Kenny here today, but he's got those Rotary Club of Tulsa Foundation t-shirts. Do you have those back there? Oh, they're outside. If you haven't gotten one of those shirts, they're $25. If you'd get one and wear it to the bell ringing day and Shop with a Cop, it'll help people learn more about what our club does and where our foundation funds go. If you buy a shirt, a portion of those funds do go to our foundation. If you've already purchased a shirt online, you can pick it up out in the foyer on your way out. If you are interested in becoming a Paul Harris Fellow for the first time, we have a generous Club Rotarian who's offered to match $500. So if you put up $500 to Rotary International, they'll match that, which then qualifies you for your Paul Harris Fellow certificate. And that will happen before the end of the year. So if you're interested, please get with Tommy Lynn. I know a member contacted me a couple of weeks ago about that. Tommy Lynn was able to help them out. It's a great chance to double your impact and join a distinguished group of Rotarians making a difference in our community and around the world. In December, Tulsa Opera, who's providing entertainment for our party here, is hosting the Do-Re Meals food drive to support our neighbors who've been impacted by the lack of SNAP benefits. We encourage you to please bring some canned goods or non-perishable food items to our meetings. We're going to collect those, and then at our holiday party, we're going to hand those off to the opera, and they will distribute those to local food pantries and partnering organizations serving families in need.
Carl, can I add to that real quick?
Yes, sir.
What they're going to do is you'll be able to vote on the song you want to have played by putting cans in a basket that has that song on the side of it. So it's going to be kind of a gamified canned food drive. That's the deal.
A gamified canned food drive. We got candy cane goldfishes and a gamified canned food drive. Can't say we don't come up with original stuff here at the Rotary Club of Tulsa. This is not Rotary DNA, but this is the power of Rotary. My friend Andrea Nielsen Bartlett sent me this letter dated July 15th, 1971 from Copenhagen. It's drafted by a gentleman named Eric Garup, who was president of a company in Copenhagen and a member of the local Rotary Club there. Andrea's father was a member of Southside Rotary at that time. He had Nielsen's gifts. Andrea still has it. Mr. Nielsen traveled around Europe purchasing things for his shop, including Royal Copenhagen products from Denmark. And he went to a Rotary meeting while he was there, and he met Mr. Garup, and they became friends. And later on, or earlier in 1971, Andrea and her friend in college took a trip to Europe for 4 months, and they went to Copenhagen, and they met Mr. Garup, who had established a relationship with Andrea's father, and he hosted them there in Copenhagen and took care of them. They were traveling with what Andrea told me was a $3 a day budget. And so when this gentleman invited them to lunch and took care of them. It meant a lot to them. But isn't that amazing? You go around the world, find a Rotary Club, and have an association with someone who has similar values to yourself. Brian Jackson was in Chile for 2 weeks. We helped sponsor him to go there for a Rotary event. Brian told me that the people there who hosted him, some of them gave him their own bed, and they went and slept on the sofa because they wanted their honored guest to have the best experience possible. That's a powerful Rotary experience. I want to thank our Rotary sponsors. Their names are on the centerpieces of your table for their support of our club. Their advertising dollars help strengthen our programs like the one we had today and make it possible for our club to thrive. We appreciate their partnership.
Carl?
Yes, sir.
Ivan and Anna, the children of Pedro.
Step up to the mic there, Joe.
Ivan and Anna, the children of Pedro, have indeed moved the memorial service up to tomorrow. They were able to get their family into town. So it is going to be at the Church of the Resurrection tomorrow morning at 11 o'clock.
Very good.
Thank you.
Thank you for that clarification, Joe. Well, thank you all for being here today. Thank you for those who are going to go do bell ringing, those who are going to go do shop with a cop. Let's go out and enjoy the rest of our week. With that, we are adjourned.